So, hi everyone. I am super happy to have with me a proud Damsonian, Dr. Hanudhanaraja B. Pillai. He has cleared his FMG July exam with a score of 184. Heartiest congratulations, Bache. We are so proud of you and we thank you for making us a part of your journey.
Thank you, ma'am. Thank you very much, ma'am.
How do you feel, Bache? Because this paper was tough and we were all sort of anxious and nervous for the results, but you've done well. How do you feel now? And let us know about your preparation strategy as well.
Actually, after first paper, I was very nervous, ma'am, because my first paper wasn't very well, because the
Yes,
PSM was very actually tough for me,
yes,
because I
I
haven't
agree.
heard anything about that, like totally weird questions. But at the same time, I used to like keep saying that clinical is my strongest thing, because I have studied everything conceptual, ma'am. And
Right.
and Gaini, you were the teacher from whom I learned, ma'am. So your flowchart
Okay.
thing, everything was in my mind. You used to teach in the flowchart way. So like
Yes,
endometriosis and Klinefelter, from Klinefelter to CH, how to differentiate between those, and
yes,
everything was in. So my main thing was paper two will be acha jayega, because my clinical is my strongest thing. So I went
great.
with confidence, and actually I scored almost. I think from recall I saw obs and gynae and medicine, which was strongest to me. I got almost correct.
That's
So in
so nice. That's wonderful.
and that's why I was very much confident, ma'am. And my strategy was that in last 7 days, like Sumir sir used to say that DAMS first aid, NEET PG ka first aid, and in that video you used to say that in last 7 days you have revised whole subject. So in
Right.
19, I revised in last 7 days, ma'am. I used to use,
Wonderful.
and I had made short notes from everything, short notes, 20th book like, and I used to revise that only. Yes,
Excellent, excellent. So I think you have studied in a very focused way and you were dedicated enough to sort of do well. And you have. And as you very rightly said, that your idea was conceptual, I think that has helped you this time because if you look at the paper, it is
ma'am.
very different from what it used to be. There were no one
Yes,
liners, it was all integrated, it was concept based, there were clinical vignettes, the options were closed, so you needed depth, right?
yes.
So if people are preparing now, Hanudha Raja, for the upcoming December exam, what would be your advice to them on certain do's and certain don'ts?
Ma'am, first, my advice would be that don't focus like everything, because I have seen in many platforms there's too much content, ma'am. And
Yeah,
like last 7 days, I cannot revise everything. In
I
something
agree.
medicine is so vast that if I do medicine, then last one year I will do only medicine only. So
I
I
agree.
didn't. So in that way, I was like perfect. I always in last year only I was sure that I have to do this thing, and this I have to leave this thing, and we have to
Correct.
catch that cleanate vinegar, ma'am. Like you said, that point, like in abruptio placenta, in one question was there. We have to catch that this thing, ma'am. Point. So do more question banks. Question bank is the main thing. Every question I have to do, and watch Sumer sir's motivational video. That's the one thing which kept me pushing, ma'am.
Yes. I would also want to ask, you're rightly saying that you should practice questions. And I think from QBank, you should do it side by side with your topic. So you cover a
Yeah.
topic, cover the question, cover the topic, cover the question. And
Yes, ma'am.
towards the end, it is a good idea to give tests, because that
Yes.
is the real format of the exam.
I actually gave test every platform free test I used to give them.
Mhm.
Every I gave so many tests in last month, only test and 20th book. That's it.
That's good. That's good.
Yes,
Yes, because you have to have an insight on what you are weak at, what are you strong at, so that you can reassess, reanalyze, and put, things into right perspective.
yes, ma'am. Yes, ma'am.
So
That's
this is
the
wonderful. And I want to know that, you've already talked about your strategy. I wanted to also know about how did you maintain, through your journey, your mental balance, your focus, your consistency. How did you go about that?
yes, ma'am. The main thing is that study partner. I used to have study accountability partner, which is my roommate. He also scored
Okay.
exact 184, ma'am. And he
That's
came in,
wonderful.
yeah, he came in your interview also. Dheeraj Bharti.
Ah,
Yeah.
yes, I just spoke to him. That's
Yeah,
so nice. So
he's my roommate.
great.
So we both used to share, and grand test also, while we were in the home, we used to call each other like 10 baje dena hai, and we used to sit at 10 o'clock. Like
So
we,
nice.
yes, ma'am. Every Sunday, every week, we used to sit at that time. Until and unless there is accountability partner, we will lose our track, ma'am. And we used to
Yes,
like keep reminding ourselves. like each other कि भाई ये करना है वो करना है
ये बहुत
ऐसे.
अच्छी बात बोली आपने, बिकॉज़ यू नो अ लॉट ऑफ टाइम्स एफएमजी में बच्चे एक दूसरे को नीचे पुल करते हैं। दे टेल दैट नहीं हो पाएगा, अगली बार करेंगे। सो इट्स वेरी इंपॉर्टेंट टू हैव द राइट एटमॉस्फेयर, द राइट फ्रेंड्स हु यू नो पुश यू इन योर लोज। देखो लो तो होता ही है कभी ना कभी, वी ऑल हैव अ सेटबैक, बट देन देयर हैज टू बी समवन हु पुशेस अस राइट बैक, है ना?
Yes, ma'am. Yes, ma'am. That's a very important friend to find, ma'am.
That's and I'm
Luckily
so
for,
glad. Yes, you are lucky with God's
yes,
grace, you know, that you could have the right environment where you could flourish, and that's
yes,
what is important.
yes, ma'am.
And anything else that you would specifically want to tell that, um, you know, like basic sciences bhi the, wo bhi is baar application wale aaye the. So anything that you want to give an input about subject wise or whatever?
Like my main input and my advice for junior is that conceptual is everything, because we will forget obviously if that one question was that housemaid knee bursitis was there, ma'am, question.
Yes,
If
yes,
like in that, if there I didn't know, I forgot the anatomy, I didn't exactly remember what, then I used to
right.
like logic bhi kaam aata, ma'am. Logic, the housemaid knee, how would she sit in the four legs and
Yes.
do, so maybe that one. So that logic and conceptual, as I said, we have to catch that point, so do many questions and revise everything in last 7 days. That's the main thing, man.
That's absolutely correct. And you've said one thing which is very nice, because when you learn conceptual, you try and retain it for a longer time as compared to only mugging up or, you know, superficial knowledge. वो थोड़ी time बाद भूल जाता है.
Yes,
Also,
ma'am.
बेटा, I would want you to tell something about PYQs, क्योंकि उसको लेके भी बहुत FMGs को मतलब कुछ भी बोला जाता है कि सिर्फ PYQ कर लो, सिर्फ याद कर लो. तो what
Ma'am,
would be your input?
even I was like my seniors and everything. Everybody told in YouTube also. I watched several videos. They told that PYQ karo PYQ, but this time no PYQ was there. And ma'am,
Right.
you won't believe I did NEET PG PYQ also, and same exact question was there.
Yeah.
So that's the thing, that another NB same platform. So NEET PG
Yes.
bhi PYQ karna chahiye, but at the same time PYQ se I used to take previous year topics and focus on
Yes.
that much more than the questions, ma'am.
वेरी गुड, दैट्स हाउ इट हैज टू बी. देखो पीवाईक्यू से हम सबको आइडिया लेना है कि अभी कौन सा टॉपिक ट्रेंड में चल रहा है, हाउ
Yes, ma'am.
क्लोज दे फ्रेम द ऑप्शंस सो दैट दोस पर्टिकुलर टॉपिक्स वी गो इनटू द डेप्थ, है ना? तो
Yes, ma'am.
उन टॉपिक्स में आप डेप्थ में जाओ, बाकी आप अपना विड्थ कम कर दो, मगर
Yes,
एटलीस्ट थिंग्स व्हिच आर लाइकली टू बी आस्क्ड उसमें आपको डेप्थ में जाना पड़ेगा, राइट?
yes, ma'am.
और कोई और भी ऐसी चीजें जो आपको लगता है कि एफएमजी बच्चों को बोली जाती है मगर आप अपनी तरफ से कुछ बताना चाहोगे?
Only one thing is stick to one resource and go for DAMS. That's it. That's the only advice I'll give.
That's so kind of you. I hope we are able to do justice to your efforts as well, because we know that it is important for you. And everything that you say, we pushes us as teachers also to go an extra mile. So we'll keep trying and
Thank,
give our best as well. Right.
thank you.
And thank you again for making us a part of your journey. I wish you all the very best.
Thank you, ma'am.
And also, one input from my side, that you
Okay.
know now you are already in the right momentum, you're in the right mind frame. Use
Okay.
this to accelerate your preparation.
Okay.
Okay,
Okay.
don't fall back right now. This is, you are absolutely, I would say, in the right stage to even prepare for NEET PG. Your
Yeah.
mindset is right, your approach is right. So
Okay.
use this time to channelize your energy, and I'm sure that we will meet again
Sure,
on the
ma'am.
platform
Yes,
for you know celebrating yet another success in your life.
yes,
So
ma'am.
my good wishes, our blessings, and thank you for making us a part of you. So
Thank
God
you.
bless you and keep rocking.
Thank you, ma'am. Thank you, ma'am. See you, ma'am.
Thank you.